The color of your urine might be telling you more about your health than you realize. Hi, I'm Dr. Ross. In this video, you'll learn what different urine colors mean, which changes are harmless, and which ones should never be ignored. If you care about your health, follow this channel. Many people make one mistake. They notice a change, assume it's nothing, and wait. Sometimes that delay turns a small problem into a much bigger one. Today, I'll show you what your body might be trying to tell you. Before we get into the warning signs, you need to understand one simple fact. Your urine carries clues about what is happening inside your body. Most people never pay attention to those clues, but once you understand what you're looking at, you'll know when to relax and when to take action. Your kidneys work around the clock. Their job is to clean your blood and remove waste products. Every day, they filter huge amounts of fluid from the bloodstream. Most of that fluid goes right back into the body. What remains becomes urine. Part of that urine contains a yellow pigment produced when old red blood cells break down naturally. Your body makes this pigment all the time. The thing that changes most often is the amount of water mixed with it. Less water means darker urine. More water means lighter urine. That is why dehydration often makes urine appear dark yellow. On the other hand, urine that looks almost clear may mean you're drinking large amounts of fluids. In many cases, color changes are completely normal, but not all of them. Wait, this is important. One color change deserves immediate attention. Pink or red urine. If you see blood in your urine, don't assume it will go away on its own. I remember a male patient in his 50s who noticed his urine had a pink tint. He felt completely fine. No pain, no major symptoms, nothing that made him think something serious was happening. At first, he almost ignored it. He thought it might be something he ate. Fortunately, he decided to get checked. After proper testing, we found an early bladder tumor. Because it was caught early, treatment started quickly, and the outcome was good. The lesson is simple. Feeling well does not always mean everything is fine. Now, blood in the urine does not automatically mean cancer. In fact, many other conditions can cause it. Urinary infections, kidney stones, prostate problems, even intense exercise in some cases. But the cause does not matter until it has been properly checked. If you notice pink, red, or blood-colored urine, book an appointment as soon as possible. Do not wait for it to happen again. Do not spend weeks guessing. Get answers. That decision could make a huge difference. And there is another urine color many people misunderstand: dark brown urine. Most of the time, dehydration is the reason, but sometimes the explanation is more serious. We'll talk about that next, because many men mistake a warning sign for simple dehydration. If you miss this part, you could mistake an important warning sign for something harmless. Let's continue from that dark brown urine we mentioned. Sometimes dark urine happens because you haven't had enough water. But there is another possibility. After extreme exercise, especially if you suddenly push your body much harder than normal, muscle cells can break down and release substances into the bloodstream. Your kidneys then filter those substances into the urine. The result can be urine that looks brown, tea-colored, or even like cola. This does not happen every day, but doctors do see it. Have you recently started an intense workout program? Did you complete a difficult race or endurance event? If dark urine appears after heavy exercise, drink fluids and monitor it closely. If the color stays the same, or if you also feel weak, severely sore, sick, or unusually tired, seek medical attention quickly. Now let's move to another common change: cloudy urine. Many people panic when they see it. In reality, cloudy urine by itself is often not serious. Sometimes urine becomes cloudy because it is concentrated. Sometimes small particles settle into the urine. If you feel completely well, increase your fluid intake and check again the next day. But the situation changes when symptoms appear. Cloudy urine combined with burning during urination, frequent trips to the bathroom, lower abdominal discomfort, or pain should not be ignored. Those symptoms may point to a urinary tract infection. Male patients with urinary tract infections often need proper evaluation because these infections are less common in men than in women. That means doctors usually want to understand why the infection happened. Have you noticed any of these symptoms? Pay attention to this next part. Foamy urine is one of the most overlooked signs I discuss with patients. A small amount of foam once in a while is usually not concerning. The force of the urine stream hitting the water can create bubbles. But when the foam keeps returning day after day, the story changes. Persistent foamy urine may mean protein is leaking from the kidneys. Healthy kidneys normally keep protein inside the bloodstream. When protein starts appearing in urine, it may be an early sign that the kidneys are under stress. This is not something to panic about, but it is something worth checking. Many kidney conditions are easier to manage when found early. That is why ignoring ongoing changes is never a good strategy. Now let's break a common myth. Many people believe unusual urine colors always mean disease. That is not true. Food, vitamins, supplements, and medications can all change urine color. Orange urine, for example, may appear after certain vitamins or periods of dehydration. Some medications can create striking color changes that look alarming, but are completely expected. This is why doctors always ask about medicines, supplements, and diet when investigating symptoms. Now, here is what helps most. If you notice a urine color change that lasts more than a few days, schedule an evaluation. In my clinic, I see this often. The first step is usually simple. Doctors review your symptoms. They ask about medications, exercise, hydration, and recent health changes. A urine test is often performed. Depending on the findings, blood tests or imaging studies may follow. For your part, focus on the basics. Drink enough water throughout the day. Do not ignore blood in the urine. Pay attention to persistent foam. Seek help for cloudy urine with symptoms. Keep track of changes instead of guessing. To reduce future problems, stay hydrated, manage medical conditions such as diabetes and high blood pressure, avoid smoking, and attend regular health checkups. Most men wait until symptoms become impossible to ignore. That is the mistake. The earlier a problem is found, the easier it often is to manage. Watch for these signs. Act early. Most men wait too long. Don't make that mistake. This video is for educational purposes only and does not replace a consultation with a qualified doctor. If you want simple, clear medical guidance like this, subscribe and stay informed.